Afternoon, everyone, and thank you so much for joining us this Monday for our second Seat at the Table event of this legislative session. We're just going to give everyone a moment to get zoomed in, to get settled in. Today's also Mental Health Advocacy Day. So for everyone who's been participating in that, welcome to this special, I'd say, side event that we hope will amplify and support all the work of advocates today virtually in the State House. Well, good. Well, again, welcome to everyone. This is, again, the second Seat at the Table event in a series that we're doing all legislative session. I'm really, really excited about today's event because of the speakers we have, and I look forward to introducing them. But before we get started, I just wanted to invite folks joining us today to put your name, affiliation in the chat, your hometown if you'd like, just so we have a sense of who's at the virtual table today. I also just wanted to share that this event is being recorded and will be available at the end of the day. And that as this conversation, this important conversation goes on today, please feel welcome to put questions, comments in the chat. We're going to try to get as much participation as possible. That's what these Seat at the Table events are all about. So today's focus is mental health access in Vermont, in particular as it relates to Vermont youth. And what we know from the pandemic is that we've seen an uptick in the needs of young Vermonters in particular in accessing mental health throughout our state. We've also seen just an uptick in mental health needs more generally. We saw 169 deaths related to opioids, overdose deaths, which is up about 35% over the last year. Unfortunately, we've seen an uptick, an increase in death by suicide. And as we know from engaging with our ER, emergency room professionals, our nurses, our pediatrics doctors, and we have one here today, ER doctors, is that more and more we see young people entering the emergency room. So this is a timely conversation. It's an important conversation. And I felt that the most important way to give those who are most impacted, our young people, a voice in the conversation is to put them at the center of the conversation. So today I'm really thrilled to have Lexi Lacoste from Burton Academy, who's a youth advocate on mental health access and suicide prevention. Fatima Khan, who's from Essex High School at both Lexi and Fatima are seniors in high school. Fatima is joining us as a mental health advocate representing the Vermont Youth Lobby. Dr. Pulcini, who's an emergency room pediatrics doctor at UVM Medical Center, and Danielle Lindley, who's the director of Youth, Children and Family Services up in St. Albans at NCSS, which is Northwestern Counseling, Family, and Support Services, one of our many designated mental health agencies. So to begin today's important conversation, I'm going to have Lexi go first and then Fatima. Lexi, welcome. Thank you again for joining us. I know you're joining us from Burton. Lexi, we'd invite you to talk about the youth experience and the needs that you've seen or heard or experienced throughout the pandemic, but also talking about stigma and what work we can do to end the stigma here in Vermont. Thank you so much for joining us.
Yeah, thank you for having me. It's an honor to be here with everybody today. So I kind of want to focus on resources and education because I believe the easiest way for students to access the resources is to be educated. And I just find that in my personal experience, that's not something that's happened. And so for the last 3 years of my high school experience, this year would be 4, I have been sharing my story to wellness classes at my high school. And I've also been the student leader of a club called the Yellow Tulip Project, which a high school senior in Maine started when 2 of her best friends lost their lives to suicide. And what I've been focusing on is that education is so important to ending the stigma, but it's not something that's typically talked about. And I just kind of want to share my personal story as a leeway into what I think can be done. So the first time I was ever educated on mental health and like suicide, I was halfway through my 8th grade year. Of course, I had an idea what mental health was and I knew what suicide was, but we just didn't talk about it in my middle school or elementary school. And the thing about this conversation is it happened 2 weeks after I had attempted to take my own life. And by the time you're in 8th grade at my middle school, we were supposed to have gone through 3 health classes, and all 3 of them were supposed to have at least 1 unit on mental health. And it just never happened. We never had those conversations. Our health classes were just traded in for PE classes because it was the same teacher. And I know that physical education is important, but there's not a stigma. And with mental health, there is a stigma. And that's what makes mental health so dangerous is the stigma behind it, because we all refuse to talk about it. And, we have words like suicide and self-harm and eating disorders and mental health. We consider those taboo topics and taboo words, and we steer around it. And I've always asked the question of why. And the stigma didn't just follow me at school. It followed me at home. I didn't grow up in a family where mental health was discussed or talked about. My stepmom would tell me that my mental health issues were just all in my head. I was creating them because I was attention seeking. And I was told I wasn't allowed to talk about it to anybody. So in 8th grade, after my attempt, I was hospitalized. And when I got home from the hospital, of course, all of my family, my siblings, my grandparents, they're all like, "Where did you go?" And the story I was told that I had to tell everybody was that I had a really bad case of the flu. I was running a fever of 104, and that's why I was hospitalized, that it had nothing to do with mental health. And because I was constantly internalizing this, and because there wasn't conversations about it. Like I said, the first time I had a conversation about mental health, I was in 8th grade, but I had already attempted at that point. And so I was just constantly internalizing it. And so I had been struggling for 2 years, and I would continue to struggle through my freshman year. And once I got to my freshman year, we did have a mandatory health class that was enforced by BBA. And I started learning what my resources were. However, I was very deep into the stigma and thinking that I shouldn't talk about it and that I was crazy. And those are the things I believed about myself. And so I was still internalizing it, even though I had found the resources to get a therapist. I was still internalizing it because I just had this like constant belief that I wasn't allowed to talk about it. And so finally, one of my teachers took a hint because I was failing all of my classes, and that's never been something that I've ever done. I've always like been more into books than sports, and like always done good in all my classes. And I have this one memory, and it's after I was medicated, because my science teacher actually went to my parents and said, "You have to do something more to help your daughter, because she doesn't have the resources by herself to help herself. And you obviously don't know what the resources are. So here they are." And I have this one memory. I was medicated. And I think that along with the stigma, we don't talk a lot about how mental health and medication doesn't make it automatically better. I still struggle to this day. It makes it easier to manage your anxiety, your depression, and those other mental health issues. And so I told myself that even though I was still struggling, I wasn't allowed to commit suicide until I saved one other person's life. And so on a bright pink sticky note that I still have hanging in my room, I wrote, "Be loud and proud." And so that's exactly what I did. So for the next 3 years, I go into my mandatory health classes because they're required for freshmen, and then you're able to graduate once you're a senior. And so I go back into those freshman classes, and I talk to them about my story, about like what my parents said to me and what their resources are. So how you can go to our school's health center, and here are some of the hotlines for Vermont, because those are all resources that aren't talked about enough. And throughout all of these projects that I've done with the Yellow Tulip Project, and throughout all of my experiences talking to those health classes, I've talked with a lot of different types of people who have all struggled with mental health in different ways. And I think just one message constantly rings clear, and it's that the stigma is really dangerous, and that the stigma is what is like holding back a lot of people from getting those resources. And so I believe that the easiest way to help Vermont youth is if we start having these conversations. I just find that a lot of times we can sit down and be scared of talking about mental health and suicide and the stigma. And I know it's really terrifying. I'm terrified right now talking to all of you. But nothing will ever compare to the feeling of sitting in my room and staring at that bottle of pills. And so, as terrifying as these conversations are, they're important. And I believe that we should start education on mental health at a young age. The rates of suicide, as Lieutenant Governor Gray mentioned, are continuously going up every year. And childhood suicide is also rising. Kids as young as 5 years old are committing suicide. And I think it's just important that we all recognize that mental health is not just an adolescent issue. Young children are also facing mental health disorders. And most times I feel like they start when you're a child, not all the time, but in a lot of cases. And it's just my personal belief that if a child is young enough to struggle with a mental health disorder, then they are old enough to be educated on it. We shouldn't be waiting until somebody's in middle school before they're educated on it, because at that point, it could already be really bad. At that point, we've already lost how many lives? And as a child grows up, the conversations in these health classes will get more in depth. But we have to find a way to enforce these health classes to make sure that they're taught correctly, to make sure that they are being taught, because I know my middle school, it's not being enforced. I had this one conversation with this one girl, and she lost one of her best friends to suicide, and she also went to my middle school. And she just blames herself for it. And I talked to her and I said, it's not your fault. Our middle school didn't teach us about this. Did you know the signs? And she said, no. And so it's not your fault when you lose people. You know, that's important to know. And it's important to recognize that if we don't educate, we can't help each other, we can't help ourselves, and we can't find those resources. And it's also not enough to educate students, because as a child, there's only so much you can do. You can't get a therapist. You can't go to the doctor's office. You can't be medicated without your parents' permission. And sometimes it's really hard for parents to accept that their child needs medication for mental health. Like for my parents wouldn't let me be put on medication. It took about 2 months of like going back and forth with my therapist and my doctor. And my parents just had this belief that like I was going to become a drug addict if I went on antidepressants, because I think that's also what the stigma perpetuates, is that like if you're put on antidepressants, you're going to become a drug addict. And like that's what my parents said to me. And like along with all the other horrible things and their horrible responses, like that's what I was being told at 14 years old. And I just think that parents need to be sent home resources on how to help their child, of what their resources are, and like education on how each of those resources work. Because no parent should ever believe that their child is going to become a drug addict if they go on medication, or that their child is faking it or looking for attention. No parent should ever believe that. And I think that a big part of the problem is that the stigma has been around for generations. It's not just this generation's issue, it's all the previous generations. It's our grandparents and our parents, and we all just keep perpetuating the stigma. And I think it's important that we educate our parents or our guardians on how to help us, and that the children are educated. And our teachers also need to be educated, because as hard as we try, there are still going to be students who fall through the cracks. There are still going to be parents that aren't going to help their child. And then I think it falls on to like the next person, which would be teachers and like mental health clinics and stuff like that. So like if a teacher notices that one of their kids in their class is struggling, they can send them to the mental health resources. But teachers need to know what those resources are and what the signs are. And I think that Vermont could be one of the first states to do this, to focus on mental health and to make a change for the better. And I know these conversations are hard, but they're so important. And one of the most rewarding moments of my life was I was giving a presentation to one of the health classes. And at the end, I like open room for questions. And normally I get like 3 or 5 questions. And it's mostly because the teacher's like, come on, somebody ask a question. But that didn't happen with this particular class. All of the students looked around and they all started raising their hand, and they weren't questions, they were comments. They were telling me in front of all of their students, in front of the teachers, in front of everybody that was in that room, about what their struggles were, how they struggled, if they were hospitalized, and what their parents had said to them, and who helped them, and what their schools talked about. And it gave me hope. If we create safe environments, these conversations become easier. And I mentioned at the start of my speech that one of the things that got me through was that I said I couldn't end my own life until I saved somebody else's. And as I'm here talking to you, I have helped save 5 people's lives. And it's all because at my school, I stood up when nobody else would and had these conversations. And I've given people the resources. And I've had a lot of people come to me struggling. And I've helped them go to the health office or call the helpline. And so through all of that, through educating other people on what our resources are and destigmatizing mental health, I have helped save 5 people's lives. And I just want everybody to imagine that how many lives would be saved if we as a whole community had these conversations. Thank you.
Oh my goodness, Lexi, wow. I know we're not all in a room together, but feel free to give some virtual applauses. That was extremely, extremely powerful. And keeping loud and keeping proud and keep talking. I mean, I've got a whole page full of notes here, and it's hard to reflect on everything you've said in just a few minutes, but I just want to thank you for being so brave and being so candid. And Vermont can lead, and we have to have conversations, and we have to educate our young people and kids at an early age, and parents and guardians and teachers, and just keep leading, keep showing us the way. And thanks again for just being so brave today and sharing what you shared. I next want to turn to Fatima, who is here as a representative of the Vermont Youth Lobby that has not only been leading the way on advocating for climate action, but picking up important issues that are facing young people across the state. Fatima, I think you're at Essex High School, so welcome. Thanks for joining us, and the floor is yours.
Thank you so much. It is such a privilege to be here. And I just want to say I was so touched by Lexi, and that was incredible. So thank you for sharing your story. I'm going to be talking about the impact of COVID-19 on mental health and on youth, and how we need to invest in more resources. Even before the pandemic, demand for mental health services for youth was increasing. The COVID-19 pandemic exacerbated this need for resources because it subjected youth to social isolation, loss of routine, and traumatic experiences. According to whitehouse.gov, epidemiological data shows alarming rates of behavioral health needs among school-age youth, with significant increases in the number experiencing moderate to severe anxiety and depression. What's even more concerning is that suicide remains the second leading cause of death among young people between the ages of 10 and 24. Mental health emergencies among young people have increased across the board. In 2020, there was a 24% increase in emergency room visits for mental health reasons for children ages 5 and 11, and a more than 30% increase in visits for those between 12 and 17 years old. These are driving factors for mental health problems such as anxiety and depression, and I found these mental health issues especially prevalent among my peers. Throughout the pandemic, many of my peers, including myself, found themselves living with a perpetual sense of uncertainty and hopelessness, and in response to these problems, there was nowhere to turn to. We need more mental health resources for youth in Vermont, and to expand existing ones with putting more funding into these important causes. Our state needs to be proactive in planning for the growth in mental health needs. Some strategies include increasing the pipeline of mental health providers and expanding telehealth infrastructures. Last year, I shadowed in the emergency room, and I was truly taken aback by the number of patients coming in for mental health reasons. There weren't enough beds in the emergency room as there were people coming in. It was astounding. Telehealth infrastructures can help patients avoid emergency room visits and help hospital systems extend access to services to different facilities across various regions. We also should provide more mental health resources in schools and start the conversation there, because there is such a stigma around talking about mental health. And this includes expanding the curriculum in health classes and providing better people to talk to mental health about, as counselors are overworked. Additionally, many youth still lack access to affordable healthcare coverage, and significant disparities exist among BIPOC and LGBTQ+ youth, denying services that youth need to thrive. By putting funding into these causes, we can address the disparities that exist. We have to improve our mental health systems and fundings to it, because if we want to save lives and save futures, we have to take concrete steps to improve access and to help youth find the care that they need and that they deserve. It is critical that our state puts funding into these mental health resources so that youth in our community are having their healthcare needs met and are truly thriving and being their best selves. Thank you.
Thank you. Can we hear a round of virtual applause for Fatima? Oh my goodness. Thank you for speaking so boldly, so clearly, both on the impact of this pandemic. Isolation has been really hard, right? And especially for a generation that has been stuck at home, online learning. And to bring some truth to that is so, so important. Thank you for sharing. Thanks for speaking with a lot of clarity on where we need to invest, and especially this moment where we have a lot of money coming to Vermont, right? We have this moment to think about how we're going to align our budget with our needs and really reform our healthcare system. I will come back to you later, as I do want to dive into telehealth. I think that's a really important point. How are we investing in telehealth? How are we making sure it's fully reimbursable and covered? We've taken some steps, but we need permanent solutions. Course. Dr. Pulcini, that's a really tough act to follow, but the floor is yours. Dr. Pulcini serves as a pediatric emergency medicine physician at the University of Vermont Medical Center. And I had the pleasure, I believe it was about a week and a half ago now, to tour UVM MC, the ER, with Dr. Pulcini and nurses and staff. And I think there is, as Fatima alluded to, a real crisis around the state, and we're really seeing that in the numbers and patients in our emergency room. So, Doctor, thank you for joining us. I know there's a lot happening every single day, but we're really pleased to have you here and to hear your perspective and what you're seeing. Thank you.
Thank you. You're right. It is a tough order. Thank you guys so much for going beforehand, but this makes my job a little harder. I am a board certified pediatrician and pediatric emergency medicine physician housed at UVMMC. Pertinent to Lexi, I also was a former 7th, 8th grade science teacher with a master's of education in secondary education. And all I'll say on that is I wholeheartedly agree with you. And Fatima, your outlining of stats. I also have a master's degree in public health, and your outlining of the stats and the public policy that is needed was just really inspiring. So thank you guys so much for doing that. Just so everyone knows, pediatric emergency medicine, I did a pediatrics residency at Children's Hospital Pittsburgh and pediatric emergency medicine fellowship at Children's Hospital Philadelphia, and then moved to beautiful Vermont. I wanted to thank the Lieutenant Governor for inviting me to participate today and for continuing to recognize the importance of understanding acute mental health needs across Vermont, notably among youth. It's a true honor to be speaking alongside individuals who are dedicated to shedding light on this issue, notably the persons and peers that are here today, bearing the burden of the crisis themselves. I know many of you are well versed, and Lexi and Fatima just did a great job of telling you about the challenges that are faced across Vermont for children and families. As a clinician, researcher, and advocate, the issue for me boils down to the following. There's extreme challenges in infrastructure, resources, and certainly personnel to meaningfully address the current mental health crisis in the state. I'm sure you may be aware that there was this term boarding long before, and we'll just define that kind of broadly as any patient in the emergency department, in this case children, being kept in the ED despite a more appropriate setting for them being identified. This was happening long before the pandemic, which has certainly been exacerbated during the pandemic, it was previously pointed out. I've testified previously that what I find most personally compelling are not the strains on our system, but instead on the children and families who continue to not have timely access to the mental health care they need. I remain steadfast in that declaration and appreciate the opportunity to listen to like others speak about this today. We do have to recognize, however, taking a step back, that the ongoing mental health crisis coupled with repeated COVID surges is currently thought of as an insurmountable challenge across the EDs in our state. And at times it's life-threatening for individuals seeking acute and emergent care with or without mental health issues. Vermont is not alone in this. And Dr. Megan Rainey, one of our emergency medicine colleagues in Rhode Island, was able to verbalize much better than I what so many of us across the country are experiencing. She wrote an excerpt in the Washington Post on January 21st of this year, and she stated, "It's knowing that an elderly man was on a stretcher for hours with a broken hip, lying in his own urine because there was no one to take care of him. I would add, as a pediatric provider, it's the child in pain with a broken arm in the waiting room for several hours, which we cannot reset or provide adequate pain control." Pertinent to our topic today, it's the parents of a 12-year-old who accompanied their child to the ED because the child fortunately disclosed they were having thoughts of ending their life without acting on it, only to wait hours and sometimes days for evaluation and treatment by a qualified mental health professional due to lack of staff, infrastructure, and funding in our current system for mental health. Dr. Rainey closed her piece with, "It has become nearly impossible for us to take the right care of the right patient at the right time. And from my experience, I have to wholeheartedly agree with this. I hope it is understood this is not about us providers, however. It's about the ability of all of us as Vermonters seeking and receiving holistic healthcare in a timely manner, notably among those who are suffering with both mental and physical healthcare needs." So in an effort to personally address the mental health care crisis we are facing, my team and I have been collecting data at UVMC through interviews of families and chart review data across Vermont hospitals to obtain a better idea of what is going on with a diverse set of families and children presenting to EDs with mental health concerns. I wanted to provide some meaningful quotes with families that are boarding in the ED at UVMC to help illustrate the current situation from a family perspective. I'll keep these short in the interest of time, but family one: "I think that our emergency room was completely overcrowded with mental health patients when we were there, and I can't imagine that was an anomaly. I think that's probably the rule, and I think there's a shortage of mental health care workers." Family two: "I think the biggest challenges that we were facing were all the commotion out in the hallway. I wish there had been a place that could have been more sequestered from other mental health patients that were coming in." Family three: "All I can say as a parent of a child who's had mental health issues for years now, who's gone through every process and referral and program in the state there just isn't enough out there." Regarding the family interviews, I want to reflect, we're extraordinarily fortunate at UVMC. We have a trained child psychiatrist assessing the children who are in the ED every single day. It's not a resource shared around the state, notably at critical access hospitals. We also have a host of individuals, including the family themselves, who are doing their best every day to provide any sort of environment that is therapeutic for these children. Pertinent to this, on January 17th, so about 2 weeks ago, there were 18 children and youth boarding for mental health issues in EDs across 12 hospitals in the state. 8 of them had been waiting 7+ days. Another 8 between 1 and 6 days. I cannot begin to understand the full experience of these children and families, even though we're trying our best through these interviews. In terms of the other data through the chart review, we recently concluded a review of pediatric patients who are boarding for mental health concerns, and this is across the state. We collected data from 11 hospitals who were very generous in providing this data. That was 4 general EDs and 7 critical access hospitals. The mean boarding time across 293 children over a course of a year was 4 days that they waited in the ED for mental health treatment that they needed. 4 out of 5 children had previously diagnosed mental health conditions, and 2/3 of the children were previously engaged in mental health treatment before they came in the ED. Most children, presented with suicidal ideation or a suicide attempt, and that's out of 293, 3/4 of those children presented with suicidal ideation or suicide attempt. This demonstrates the severity and urgency of this problem across the state. It's important to conclude that the data I've collected in my personal experience, there's one clear conclusion. The ED is not the appropriate setting for children to get comprehensive acute mental health care services. We have contributed a host of human resources to optimize what we have, going far beyond expectations in many instances. We have done this because watching children board in the ED day after day, confined to their room due to necessary COVID protocols, is extraordinarily disheartening, as I'm sure you all could imagine, to all individuals who are laying witness to this unfortunate circumstance. Children should be in school learning, children should be at home developing, and when needed, children should receive appropriate mental health services in the right setting at the right time to get back to the aforementioned activities. I hope that you all agree. I know addressing this situation will require investment, and I wrote a recent piece in the media. I would ask to focus on 3 things that my experience could help alleviate this crisis: that key organizations come together in each of our communities, develop programs, potentially including space outside of emergency departments for individuals needing acute mental health care. allowing maximum flexibility with the certificate of need process for the construction of much needed space for all types of holistic care to be provided, and that's all healthcare. And finally, very importantly to this audience, allocating adequate funding in the first weeks of the session to allow for meaningful change and to support our critical organizations that are struggling to hire and retain enough staff to provide care. The cost of this will be high on many levels, but the cost of not trying to provide these services for youth will lead to greater economic challenges. I can guarantee that, and most importantly, devastating on a human level. These children are our next generation, and having them experience the mental health stress that I see so many experiencing on a daily basis in the emergency room will be long after this pandemic has ended if we don't attempt to address it now. In conclusion, thank you again for allowing me to speak today on behalf of children. I hope my expertise and words were helpful, and I look forward to any questions or concerns.
Thank you, Christian. Doctor, I believe a virtual round of applause is very, very warranted. Thanks for speaking with a lot of clarity and data. I mean, I just wrote down what you said, 4 days in the ED on average for over 239 children. Right? The thing is that that's the mean. That's just extraordinary. I just don't think we fully realize what you're seeing every day, what ER doctors are seeing every day. Keep sharing the data, keep speaking. And I really appreciate the right care, the right patient at the right time, and that the emergency room is not the place for children to receive mental health care. We'll come back to you with a follow-up question at the end, but I wanted to next introduce Danielle Lindley, who is the Director of Youth, Children, and Family Services at Northwestern Counseling and Support Services. NCSS is one of, I believe, 12 or 13 designated mental health agencies, and Danielle, I hope you'll correct me, across Vermont, who've really been on the front lines of providing support in our communities and trying to work to alleviate the stress on our ERs. But Danielle, thank you for joining us. I know you have a lot on your plate. I know it's also Mental Health Advocacy Day, and you've been participating in other events, but thanks for the time, and the floor is yours.
Thank you. Good afternoon. I'd like to start by saying thank you, Lieutenant Governor Molly Gray and her team, for giving me this opportunity. I feel very fortunate to be sitting here with you to share my perspectives and my experiences. The stories that I will be sharing are from across the state and representative of an array of experiences from youth, families, designated agency staff, and our stakeholders. I'm going to share with you what we are seeing with youth and their families, the impact on the mental health system of care, and solutions that can support us in bridging the gap between the need and the resources available. What we do know is that everyone has been impacted by the pandemic in one way or another, and that no one is immune from the effects of COVID-19. Unfortunately, Vermont's youth are no exception. As the pandemic continues, mental health continues to be impacted, and as a system of care, we are overwhelmed, under-resourced, and not adequately meeting the needs of our youth. So what are we seeing? Across the state, we have approximately 342 children on wait lists trying to access services. This, unfortunately, is just the number of families who have actually reached out seeking care. As a system, we have such limited resources, we have not been able to do outreach or build the capacity that is needed in order to support the increase in need. Across the state, we have high numbers of students in need who are not receiving adequate social, emotional, and behavioral supports. Schools are seeing increased incidents of violent outbursts, vandalism, sexualized behaviors, defiance, eloping, running away, and increased threats of harm to self and others. The complexity of these behaviors is putting tremendous pressure on the capacity of our public school system. Adolescents are reporting an increase in acuity of symptoms related to substance abuse, depression, and anxiety, increase in family conflict. Youth are feeling isolated, and because they've had to isolate, we are seeing higher instances and severity of social anxiety, which is leading to an increase in truancy and youth falling behind academically. Children with autism spectrum disorder have core deficits associated with communication, social interactions, and restricted repetitive behaviors. Periods of isolation from peers, schools, and service providers has reduced access to social interaction and treatment, limiting working on increasing social skills, and in some cases actually further increasing the deficits in these areas. So how does the increasing need in the pandemic impact our services? Across the state, residential and crisis bed programs are working incredibly hard to keep doors open while managing significant staffing shortages brought on by the pandemic. Many of our hospital diversion programs are having to reduce hours of care due to COVID-related challenges. We have seen an increase in the number of youth who are being stuck in hospital emergency departments with nowhere to go because of the lack of resources or options we have. We have a large number of youth who have a need for support related to intellectual disabilities and mental health. As these children age into adulthood, their needs for both support and independence can exceed the capacity of their families to provide care. We've seen an alarming increase in the number of instances in which primary needs of housing and support go or undermet due to the lack of home providers, foster families, and in some cases, appropriate residential settings. As for the program specifically at Northwestern Counseling, our program that provides home and community-based support to children who have been diagnosed with autism spectrum disorder, the wait list is over 40 children at this time, the highest that it's ever been. These children are mainly between the ages of 2 and 4, and delaying access to these services during this age is detrimental to their progress in the future. Our wait list for outpatient services is 6 to 8 weeks. Our home and community-based setting, we are currently down 15 staff, and depending on the need and clinical acuity, this could be anywhere from 250 to 400 families that we are not able to support. We have many children right now who require one-on-one and local school settings. We have currently 42 open positions for students who need a BI in our region. Essentially, in a time when we need services to be creative, innovative, and flexible, and for capacity to increase, we are left providing less than adequate care and not able to come close to providing the highest quality of care for many youth. Think of this as a child going to the emergency room needing stitches, but all that is available is a Band-Aid. Here's what we know about our workforce. Throughout the DA system, we have a staff vacancy rate nearing 20%. In some of our agencies, we have vacancy rates as high as 50%. Our entry-level wages are often less than local retail and fast food restaurants. Our staff are leaving, experiencing burnout and exhaustion, and seeking positions in other sectors that do not involve as much stress. When our system of care is not equipped to meet the need, there's a ripple effect across schools, hospitals, law enforcement, and other providers. This has left many educators feeling overwhelmed and exhausted, which has resulted in higher numbers of teachers, paraeducators, and support staff also leaving the field. Our local DCF offices are reporting an increase in the reports of child abuse and neglect, but yet they are operating at a 51% staffing capacity. This leaves our youth and families feeling very unsupported and disconnected. The most important question then is, what are the solutions? As a system, we have to prioritize providing financial resources to address the staffing shortages and the salary inequities that exist in human services and mental health fields. We must incentivize work in community mental health in order to retain our staff and recruit new ones. When Vermont children and youth experience day-long waits in emergency departments, waiting for inpatient and mental health care, it would be natural to conclude that our biggest gap is in our system, our hospital and residential beds. However, this is a direct result of the erosion of our home and community-based services that can effectively meet the needs of our high-end and high-acuity children in the community by providing wraparound supports. We need to invest in our home and community-based system of care to support children and their families when they are not where they are at, and to support the decrease of crisis in education settings. We need to invest in programs that support mental health urgent care initiatives, such as UCS's Psychiatric Urgent Care for Kids, the Living Room Model, or Mobile Response and Stabilization Services. These models aim to provide immediate support to children, youth, and their families in crisis in a non-acute setting rather than in the emergency department. Lastly, we need to include our youth and family voice in this process. I can tell you in my role that I continually say to my teams that our system of care and our programming will never look like what it did prior to the pandemic. The need is different and our resources are different. Not to say that there aren't services that are working well and that we are doing the best job that we can during these challenging times, but this is an opportunity for Vermont to do better. In order to do that, youth and families need to be at the table. Thank you.
Thank you, Danielle. I think a round of virtual applause is incredibly warranted. Thanks for all your work. Thanks for the work of your team. Thanks to the work of our designated agencies and staff, practitioners across the state. Again, just scribbling down note after note after note on the 20% staff reduction. I mean, I can't even imagine. And with 342 kids in the wait list trying to access services, these numbers should really be concerning to us, right? We need to be talking about this data in committees, in the legislature, throughout the state, in our communities, in our homes. I mean, it's a huge, huge crisis. And it's not just a national crisis, it's a crisis right here at home in Vermont, where, as you said, we have workforce shortages and we've had them for years, but we're really now feeling the impact of that, not only on the provision of care, but on the provision of a lot of prevention and services that we need to invest in. I do want to welcome, there's 61 participants here. If you have a question, please feel welcome to raise your virtual hand or to put your question into the chat. I'm going to ask Andrew Gillespie, my chief of staff, just to scan the group. And if anyone wants to be taken off mute and to share a reflection, share a question, we could do that now. This has been such a powerful and fruitful conversation, and I'm sure there's a lot of ideas and questions. Maybe while folks are thinking and deciding whether and how to participate, please feel welcome to raise your hand again or put a question in the chat. I wanted to follow up on the question around telehealth. We're in a world where we're really quickly sort of moving into services being provided virtually. That's obviously been really tough for families, students who can't get online, either because we don't have broadband or cell service across Vermont yet, or because those physical tools, the MacBooks, the computers, are hard to access, or we don't actually have the medical billing system and reimbursement process fully in place to make that financially feasible for a lot of families. And so I guess, Danielle and Dr. Pulcini, I'll start with you. Just curious whether you see a need there, and how do you think that we kind of transform our system to have that be an alleviating resource? Just any reflections you have on that. And then Fatima and Lexi, please feel welcome to jump in.
Sure, I can start if that would be helpful. I would say that telehealth has been an incredible tool and an option for us to access. In my experience, telehealth has been invaluable to adults. The interesting thing when we rolled out telehealth for youth is that one positive that came out of that, it was actually served as a bridge to engage parents more, because I think traditionally a lot of our school services, you know, the treatment team meetings, things like that, it would be the school and maybe our staff, but this allowed more options for parents to participate and also for more educational opportunities. I will say telehealth has been hard for kids. You know, as a state, you'd probably see that within our DA system, our hours of care have decreased. And, you know, a lot of that is attributed to families are exhausted. And to try to have them, you know, participate in this an hour-long Zoom meeting can be very difficult, particularly for children. So I think we continue to capitalize that is an option and a tool that we can use. But, you know, we're back to fully in-person services because that's what's most effective for children.
Thank you. I think I heard a doctor at the Rutland Regional Medical Center say telehealth should be a right, but it's not the right health for every person. And maybe that's, as you're saying, that's the case for mental health care, especially for kids. Dr. Pulcini, anything to add there?
I would just say the pediatricians in the state, and speaking of somebody who's a member of the American Academy of Pediatrics and speaks frequently with primary care providers, of which I am not anymore, is that they're doing an incredible job of doing the best they can to support kids in the community, probably practicing way beyond their means in certain instances, notably with mental health crises. And they're doing their best because of the services that Danielle outlined are in such high demand that it's just necessary to take care of kids. And so if you think about telepsychiatry also as a way for children to connect through their medical homes, or child psychiatrists to connect to the primary care providers, I think that's one strategy that could potentially be helpful. As Danielle pointed out, it's not a one size fits all. It's certainly one strategy that could potentially be helpful if supported, and it's been successful in Massachusetts, for example. But I don't think it's certainly, I think it's a multi-pronged approach. It's certainly necessary that a lot of people have already pointed out, both across education and the health sector.
Thank you. Fatima, you brought it up, and so I wanted to come back to you.
I personally think that, like, hearing other people's opinions have been great. I certainly think there's a difference for like telehealth psychiatry between, like, younger kids versus like young adults. I know that a couple of my peers switched from their therapy appointments from like in person to like over Zoom during COVID. And even there's certainly a difference by having it like online versus in person, but it was still like invaluable for them because they still had the opportunity to speak with a provider and to kind of get out of that social isolation bubble by having that resource provided. So yes, it doesn't work for everyone, but I do think that when it works, it certainly does work. And you can see that across like, especially young adults, I think.
Yeah. I think that's a great point on the age. I mean, for 5, 6, 7, 8, 9, 10-year-olds, maybe not. For 16, 17, 18-year-olds, it has to be, as was discussed, the right care for the right person at the right time. And whether it's via telephone or broadband video, it was really determined by the patient. Lexi, do you have anything to add on that? We do have a lot of questions coming in, so I'm going to shoot those off in just a second here.
Not really. I agree with everything that everybody else said. I know that I used, like my therapist and I had phone calls during the pandemic. I'm just able to go in person now, large distances, double masked up, both of us. But I think, as everybody else mentioned, it is definitely for only certain people. For me, it wasn't really helpful just because I like to be in person more than over the phone. And like over the phone, there's so many distractions at home and stuff. Like I have little siblings and I have 2 dogs and like, you know, my dogs would start barking or something. And so I think it is a very helpful resource, but as you mentioned, for the right person at the right time. So, yeah.
Thank you.
Great.
Great.
Governor, it looks like we have a hand up from Bridget Connery.
Sure. And we've got a number of questions. Why don't we have Bridget ask her question, and then we'll get to many of these in the chat. Thank you all for chipping in. This is terrific.
Hi, thanks. So I don't really have a question. I just want to stress some of the points that have been made already. I have 2 daughters who have needed acute mental health support, 2 teen daughters, and we have been fortunate to have an excellent experience with the resources that we've worked with, both at the public school systems that we've been in, the DCF, NFI, and I can't stress enough what Lexi was saying about the importance of the family being involved in having resources, because they wouldn't have gotten through it if I didn't have the support too, and being able to call first call when I needed help in order to be able to handle what was being presented to me by my kids is just as important. And so, it really does take a village, and we need to find a way, like the RAP services, Spectrum Youth, all these things that we've had have been enormously helpful. And I'm in a position where I'm lucky enough where I've had the resources, both financially to be able to afford to take advantage of some of them before, my deductible would end out. And I also had a work environment that's been very supportive of me taking the time to leave whenever I've needed to in order to handle any situation that was coming up. So it really is about supporting the families to support these kids' mental health. So just very brave, Fatima, for speaking up. I really appreciate it. And Lexi, thank you.
Thanks, Bridget. And I think the point is so well taken. And part of our conversations around ending the stigma is making sure that parents and teachers and young people aren't trying to navigate a process in the shadows by themselves, right? This is, these are resources and education that needs to happen with communities, families, out in the open, with our statewide. And there's a lot of questions here. I'm going to try to get to as many of them as I can. Question from Beth Rusnak. Do we know if we're short on qualified resources to help children and families? Because those resources stepped out of this field. I think the question is really around, did we lose people during the pandemic? And then what do we need to do to recruit or retain more people in this field? And I think, Danielle, we'll start with you, and then Dr. Pulcini, have you jump in. I think that you both have a lot to say here on how we can recruit and retain and keep people in this profession that's so desperately needed right now.
I'll lead with yes, absolutely. We have lost people in the pandemic. Just speaking at NCSS, roughly prior to the pandemic, we had a little over 300 staff in Children, Youth, and Family Services, and we're down to about 245 staff. And so it's pretty disheartening. But what we have really rallied and come together and said, you know, that our system of care is going to look a little bit different, but we're all committed to the work. I think, you know, as I spoke to earlier, the number one thing is that we need competitive wages to recruit people. Staff are putting themselves at risk with exposure to COVID. You know, they're in people's homes and communities. It's a lot of stress. Everyone's under crisis. So they're experiencing that with families. They're also experiencing their own personal crisis and struggles related to the pandemic. And so there's just not an incentive for people to join our field. And so we need to really create those opportunities to create competitive wages and to incentivize the work.
Thank you. Dr. Pulcini, anything to add there?
Yeah, I can echo that from somebody who has absolutely no stake in the game about people's wages in the mental health system. I mean, you overhear now, and with COVID, there's staff shortages everywhere in every industry, and somebody can get a job, you know, particularly a particular job at a restaurant, perhaps, and be cleaning dishes for $19 to $21 an hour. Or you can get a job taking care of children who are really struggling on a day-to-day basis with mental health care needs. There is a concept called transference where you're going to accept some of that onto yourself as an empathetic individual. That's a challenging job. And to not acknowledge that and be reimbursed appropriately is really unfortunate. And I completely understand the challenges that people face every day in the community and that the families face, and that the support they need is just not there. And I would say, yes, reimbursement, tuition reimbursement programs, loan forgiveness programs, whatever can be done to bolster staff immediately should be done, and as well as to attract people into the field.
Those are terrific ideas. And there's a lot of questions about where do we go from here. We're going to go to those questions in just a moment. But there's one question here about how can we help families and school staff in the day-to-day relationships and support for youth. It's a question from Kathy Printon with acknowledgement of what Lexi and Fatima shared in particular. Lexi and Fatima, do you want to try to answer this one? As you're in school every day and you're seeing the stress that it's putting not only on yourself and your peers, but also teachers and staff. And Lexi, Fatima, why don't we start with you, and then we'll go to Lexi. Sorry.
Sorry. I think that's a really good question. I think the first point is, which Lexi made, is to really destigmatize the conversation around mental health. And this can be done by especially working it into the health curriculum through health classes and stuff. And also by providing more access to counselors that are better trained in mental health, I think is especially important because I feel like a lot of counselors don't know how to talk about mental health. They're really overworked because they have to work with students through a variety of problems and issues. But I think the most important thing for school staff and for people who work in the schools to do is to build better relationships with their students. Because how can a student come to you and talk to you about mental health if they don't trust you and there isn't that established connection? And then to provide more education.
Thank you. That's terrific. And Lexi?
Yeah, I also agree with everything that was said. I think that it's definitely important that if a teacher wants to help their students, then they have to have a good relationship with them. And that teachers need to be educated on how to tell when a student is struggling. But in terms of taking the weight off of teachers and families' shoulders, I think that all schools need to have a good system of health clinicians. I know that BBA, we have 3 right now. We have 3 health clinicians, and we're still, as a school of 700 kids, they are still flooded every single day trying to find time for everybody. And I know that not all schools are as fortunate as BBA is to have 3 clinicians. And I think that it kind of ties back to what can we do to get more people in the field. So we need to get more people back in the field and into schools, because if we're trying to help youth, then that is where we can help catch the problem. And I also think that it's very dependent on teachers and families to have good relationships with their students. Like my parents didn't try. And so we just didn't have that good relationship because they didn't want to help me. And so I think it also ties back to this issue of if a parent wants to help their child, then giving them the resources will help. And if we have these resources at school, it'll take weight off of the family and weight off of the teachers enough to be able to have their own headspace to help their children. So, yeah.
Thanks, Lexi. We've got 5 minutes, and I feel like this conversation deserves a lot more than an hour, but I want to be respectful of everyone's time. There are a lot of questions in the chat about where do we go from here? How do we make sure this is not a one-off conversation, seat at the table event, but really all the information that was shared today about the statistics, about the need, is transformed into action. I spent the last 8 months in communities across the state and put forward 6 action items. I'm going to read 4 of them. But what I'd like to do is close by giving all of our speakers the opportunity to share. Again, if there's like 4 things or 3 things or 2 things that you want legislators in the state to hear coming out of this conversation today about where we need to invest, that you say that you share that, and we document it as we try to move forward and really sound the alarm bell on why this system is at a breaking point right now and that we need to move quickly. So from my perspective, and I think some of this was captured today, we need to set a long-term sustainable budget for Vermont's designated mental health agencies. Our mental health agencies cannot be working from budget to budget every year, that we need to have long-term sustained investment. We absolutely need to support workforce recruitment and retention, including cost of living adjustments to account for how expensive it now is to live and work in Vermont. We need to support the recruitment efforts by expanding, and I think Dr. Pulcini recognized this as well, student loan forgiveness, or actually free tuition potentially for those who agree to go into this field and to stay in Vermont and to help our communities and schools and hospitals. We need to adjust Medicaid reimbursement rates. That was mentioned by the governor in his budget address. I know that is a focus of his. In addition to accessing mobile mental health units across the state. And I still think that this is a moment where designating a statewide task force to address this issue, to focus on ending the stigma, to focus on young people in particular, would be the right step in the right direction. And I'd certainly be happy to be part of that. But it needs to include the voices of everyone here today. It needs to include the voices of young people. It needs to include the voices of practitioners and leaders across the state who are working every day to help us address this issue, because ultimately I think Vermont can lead. So with that, I want to give the floor in closing remarks to our incredible speakers. We're going to go in reverse order. So Danielle, we're going to start with you.
Okay, I think I would just end that, when I think about my staff and what we've been through the last 2 years, I would just heavily advocate, to your point, around the Medicaid reimbursement rates and incentivizing our workforce. We have such good people that want to do such good work with families, and we just cannot recruit them and keep them because of the situation that we're in right now financially. And I would also really advocate that we have to do an investment in our home and community-based programming. I think when you think of mental health, traditionally, a lot of people look at outpatient and psychiatry and residential, and there is so much work that can be done upstream and preventative in order to be able to support families from accessing those services in the long run. And so we have to prioritize and provide the resources needed to bolster that system of care.
Thank you. Thank you for joining us today. Dr. Pulcini.
I just wanted to point out that I'd never met Danielle, Lexi, or Fatima before today, and we are 4 very different people from different backgrounds, and we all agree. And I think that's really powerful, speaking about the rhetoric that's always in the news. And we all agree that more mental health services are needed immediately now. And I would say as an emergency medicine provider, that is absolutely true. When I see patients and families in the ED every day, things like geographically diffuse. Vermont is a big state, like partial partial hospitalization options or brief crisis stabilization options would be great. Wraparound programs that encompass intensive in-home, community-based, school-based supports are incredibly important. And then making sure that access to child psychiatry is equal across the state would be extraordinarily important, as somebody pointed out in a question about telehealth, and supporting people's medical homes as well as supporting the schools so people have equal access to mental health care across Vermont. It's a big investment, but I don't know anybody who has interaction with children right now in this state that wouldn't agree with almost everything that us four have been saying.
Absolutely. Thank you. And Fatima.
I want to emphasize like putting more funding into resources, and I quickly want to address one question in the chat that I thought was really like essential and I could not address about the disparities in telehealth. And I think that's an amazing point. And I think one thing that we really have to do is identifying where in the healthcare process the disparities manifest, which is essential in order to inform effective programs and empower patients and improve health outcomes. And we can work on this in the telehealth medicine systems through the development of, culturally and structurally appropriate tools and technology, and providing representative provider presence and capacity, and doing positive targeted outreach. And these are just some of the steps that we can take to ensure that we truly have like an inclusive telehealth system that people all across different economic, different like financial means can access. So that was my point about telehealth, and just in general, like we need to be more proactive in planning for the growth and mental health needs, and really putting our funding where we think the disparities lie.
Thank you, Fatima. Promise me you'll keep leading and keep talking and keep speaking with such clarity and purpose. We need you. And Lexi, last word goes to you. No pressure.
I think that I just want to reiterate that the funding, as the last three panelists mentioned, is so important. We can't do anything without the funding. And I think that, as I said, we need to mandate health classes for young ages, because resources and funding are nothing without the education behind it. And we need to bring more health clinicians into schools and make health clinicians more available outside of schools. And so that ties back to the funding. So education and funding are, I think, the two most essential things that we can do right now.
Thank you. I would love this conversation to continue, and I hope it does. It's going to, but I'd ask everyone joining us today virtually to give our incredible panelists a round of applause. This is such an important conversation right now, and it's going to continue. There will be a recording of this seat at the table available and posted. We'll share it with your community, share it with your neighbors, share it with your legislators. This is just the beginning, and we're going to be putting together tools, materials, quotes, and data from today's conversation to keep our eyes and ears and head focused fully on addressing this issue, because this is our opportunity with the funding coming to Vermont, and our opportunity to really lead and change the conversation. So thank you again to our panelists. Thank you to everyone for taking time to join during your lunch break today. Let's keep this conversation going. Have a great week.